Her 14-month-old son, Grayson, went through what a lot of families across the country are experiencing, with respiratory illness overwhelming hospitals and causing scary situations for young children. 14-month-old Grayson Swain is one of hundreds of little ones across the country infected with RSV, a respiratory virus that's common for his age. But Grayson's mother, Jacqueline, says his case was more severe.
He was sleeping 14 plus hours, and then when he couldn't breathe. So it's called chest caving, where they're working their bodies so hard to breathe, where sometimes you can see their ribs because they're working so hard just to get the oxygen to their lungs.
Jacqueline said Grayson's case was so severe he wasn't eating or drinking. Thankfully, Grayson is now home and healthy, following a very stressful 5-day stay at Hasbro Children's Hospital and an overall 2-week recovery.
It's really scary because even the healthcare professionals were saying they hadn't seen it this bad. So to see your little one suffer like that, it's really overwhelming and scary.
Currently, there are 21 cases of RSV at Hasbro. Medical experts say viruses thrive in populations that haven't experienced them. Dr. Amy Nunn of the Rhode Island Public Health Institute says infants who were born post-pandemic have a lower sense of immunity and are more susceptible to a severe case of RSV, now that little to no masking or other COVID mitigations are in play.
A lot of things that we've been protected from over the last couple of years, now we may be a little more vulnerable.
While Nunn says we could see an even greater spike in RSV along with flu and COVID cases as part of a tridemic, the way to fight back is to get vaccinated, especially young children.
I think about 40% of children in Rhode Island have been vaccinated. And among those, I think less than half of them have been boosted. So there's still a big public health opportunity for us to improve our vaccination rates because these things often travel together.
Now, RSV is surging at an even more alarming rate over state lines in Connecticut, where they've actually considered calling in FEMA or National Guard for more assistance. Now, I asked Rhode Island's public health director if that's something we could see here in the Ocean State, and she said no as of right now. In Providence, Hector Molina, ABC 6 News.